Hello viewers, welcome back to my YouTube channel, Holistic Nutrition by Angie, and today I'm joined with a very special guest. She's a friend and also a mom. Please introduce yourself to my viewers.
Hello viewers, my name is Rispa. It's a pleasure being here. I hope you're all going to learn a lot.
Yes, we are going to be discussing the benefits of exclusive breastfeeding to both the mother and the infant and how you can increase your milk production. Stay tuned.
Maybe you should start off by telling us what exclusive breastfeeding is.
This is the way in which you breastfeed your child entirely for 6 months without giving any form of water or food, because breast milk is enough to sustain a baby for the first 6 months. Yeah.
What are some of the benefits of exclusively breastfeeding your baby?
So it has many importance both to the baby and also to the mother. So to start off with the importance of the baby, this breast milk has, the first milk that you give your baby, it has something known as colostrum. Colostrum is an antibody that you transfer to the baby that is going to help in fighting of any infection, also to prevent the baby from getting any infections in future. So that is the first importance of exclusive breastfeeding. The second one is that the breast milk is easily available. You don't have to look for it, it's there with you. So that way it's easily accessible to the baby, and it also has the right temperature. So you don't have to warm it, you can easily give it to your baby. The next importance is it has all the essential nutrients you require. You don't really have to look for your water or fats or anything. It has every essential nutrients the baby requires from the beginning up to 6 months. Okay? So another point is it also helps in the development of the baby's brain. You find the baby who exclusively breastfeed for 6 months, the IQ is very high, and also proper development and functions of the brain. Not forgetting, it also has, besides having all the essential nutrients, breast milk is also going to help the baby in growing and having a healthy weight. Breast milk also helps in bonding of both the mother and the infant. So this is both beneficial to you as a mom and also to the baby. You will bond more when you breastfeed your baby. So going to the importance to the mother is that it's going to help with healing of your uterus very fast. Most mothers, when you breastfeed your baby, you have the hormone known as oxytocin that is going to help with healing of the uterus very fast, and that way you'll be able to develop very fast as well. It's also going to aid in shedding of the weight that a mother has gained during pregnancy. When you breastfeed your baby, you can easily shed off quickly. Yes.
Okay. So how do you tell that the baby is properly latching?
So I have a dummy with me to demonstrate that. So today we're going to demonstrate how you're going to be holding your baby when breastfeeding. Most mothers, you can always take a pillow. For instance, let me use this pillow. You put it under your lap, and then this way you'll be able to hold the baby very well, and making sure the baby is not seated on the wrong position, seated directly next to your nipple. So making sure the nipple and the black part of the breast is directly inside the baby's mouth. So that way the baby has hold the breast very well. And you find that when the baby hasn't hold the breast or the nipple, they'll start producing the clicking sound. That way they're gasping a lot of air. That means they're not suckling on the breast milk. Make sure the baby is breastfeeding silently, not producing the clicking sound, and the head of the baby is directly next to your nipple. That way you know the baby has hold the breast or latching properly.
For my case, I had a problem with cracked nipples. They were so. Is it a problem with poor latching?
Yes, that is very true. Poor latching can affect both you and the baby. So for you, you know that milk has the enough oil and all that. So whenever you're breastfeeding your baby and they're latching well, they're not pulling so much from the nipple. So if they don't latch properly, you find that most mothers start developing cracked nipple. Another problem for the baby is that if the baby doesn't latch well, they can easily develop acid reflux because they're gasping a lot of air, and that way the air can just cause the acid to come back on the esophagus. So please make sure the baby has latched well in order to protect you and also the baby from getting acid reflux. Yeah.
How long are you supposed to take to breastfeed the baby, maybe on one breast or the other?
That's a very good question. You find that most mothers can easily change breast. You breastfeed your baby for 2 minutes, then you change to the other boob. That is super wrong, because the first time when you're breastfeeding your baby from one breast, you're able to give the baby the first milk. It's able to quench the baby's thirst. You're not getting all the essential from the first few minutes. So if you continue breastfeeding your baby, the mature milk that comes out now, it's going to give the baby all the essential nutrients. So you're supposed to hold your baby and breastfeed the baby one breast first for about 10 to 15 or even 20 minutes. Then you can easily, if the baby has fed well, you can easily change the breast after a few minutes, or wait till next time when the baby demands to be breastfed, then you can use your other boob. Don't always change after 2 minutes, you're changing the boob. The baby will not get all the essential nutrients they require.
Okay. Yeah. What are some of the cues that the baby is having enough milk?
You can easily tell the baby has gotten enough milk. First of all, the sleeping pattern of the baby. So most babies who are breastfed well, they can easily sleep all the time, and that will really help in their growth and development. Another way is the way you change your baby's diaper. So when you change your baby's diaper all the time, like at least 8 times and above per day, if they've peed or gone for their long haul, that is an indicator that your baby has breastfed well. So those two are the main points you can always note to ensure your baby has breastfed.
What is your advice on those parents who are not able to exclusively breastfeed, maybe due to low milk production?
So before you think of buying formulas, make sure, let's look at what is the cause from your diet point. So most parents, especially, they don't incorporate a balanced diet. You have to eat a balanced diet that has the fiber, all the essential nutrients that you require, and also drink a lot of fluids. That way it will help with milk production. And the other foods that can really limit your milk production, for instance, if you're taking too much of alcohol when breastfeeding, or smoking of cigarettes, others even drink so much coffee, that can easily inhibit your milk production. You need to reduce that. Not forgetting, stress is a very, very big contributor to low milk production. So try and control your stress and other factors that I've mentioned, and this way you'll have at least more milk production. And if you've tried all these things and you don't have enough milk, please talk to your pediatrician or your nutritionist on how you can introduce supplements at home.
In my case, I had a problem with colic. So what is your advice on parents who are experiencing a similar situation?
Very good. So colic in infants is very, very common. Some experience it, some don't. And if you find your baby experiencing colic, some of the signs is the baby will cringe so much and squeeze themselves in so much pain. Others will cry a lot, constant crying every time, especially at night. They don't want to sleep. They're crying all the time. Some kids may also pass gas, and that is a sign that maybe your baby is experiencing colic. And some parents, because the babies the digestive system is not well formed of the baby, anytime they start breastfeeding the baby, they may experience these signs. So how do we help reduce colic? First of all, after breastfeeding your baby, you can always put them on the shoulder, yes, and you burp the baby to make sure at least they pass the belching sound out. So that is a sign that your baby will also reduce colic. Another sign of that comes from the mothers is we observe your nutrition. So some of the foods that can easily affect the baby, they're called allergens, and they can easily get it through the breast milk when you're eating certain foods. So you visit your pediatrician or nutritionist, and they can be able to cut out some of the foods such as wheat, eggs, gassy vegetables such as cabbages or cauliflower. Those are some of the foods that can easily cause allergic reaction to infants. So when you tell your nutritionist, they'll be able to monitor your diet and change certain foods that can easily cause colic to your infant. But don't worry, parents, sometimes your kid can outgrow the colic. But if you feel like after day 1, 2, the symptoms persist, please visit your medical provider or pediatrician or your nutritionist, and that way they'll be able to guide you on what foods to eat and how you can continue helping your baby with colic.
Thank you so much for having me today. I have learned so much. I know this information is going to come in handy, especially with my future babies.
Yes, yes,
I
yes.
hope that viewers back at home have also learned quite a lot, and you're going to put into practice whatever we've learned today.
So I want to thank the viewers as well for watching. Not forgetting, if you've not subscribed, please subscribe. Comment below on any questions you have on breastfeeding, and I'll see you guys next week on part 2 about complementary feeding.